The House passed health care. What do you think of the bill they passed? And do you still intend, if there is a public option and if there's this tax on so-called Cadillac health plans, will you support a Republican filibuster on final passage in the Senate?
Well, there's some good things in the House passed plan. You know, I think we ought to do health care reform this year to deal with the two great problems that President Obama and others have talked about. There are unsustainable, continuing increases in the cost of health care. We've got to stop that. And there are millions of Americans who don't have health insurance. But I'm afraid that our colleagues in the House added a lot onto that subtract from the genuine purposes of health care reform. And one was to create a public option plan. The public option plan is unnecessary. It has been put forward, I'm convinced, by people who really want the government to take over all of health insurance. They got a right to do that. I think that would be wrong. But worse than that, we have a problem even greater than the health insurance problems, and that is a debt. $12 trillion today, projected to be $21 trillion in 10 years.
So at this point, I take it you're a no vote in the Senate.
If the public option plan is in there, as a matter of conscience, I will not allow this bill to come to a final vote, because I believe the debt can break America and send us into a recession that's worse than the one we're fighting our way out of today. I don't want to do that to our children and grandchildren.
Senator Lieberman, thank you. Thanks for coming in today.